Hi, my name is Dan Dixon. I'm here at Impact Sport Performance Center, and I'm here with Bill Scanlon. Today we're going to be demonstrating ACE wrapping on a swollen knee after an acute injury. So we're going to look at acute swelling of the knee, some things that we want to take a look at that we don't want to wrap if some contraindications, uncontrolled heart disease, arterial disease, skin abnormalities, and advanced peripheral neuropathy. Those are things that we want to avoid wrapping if we are aware of any of those types of conditions. So we're going to take a closer look at how to wrap the knee properly. Some things that you want to take a look at first. They come with these little metal clips. We don't want to use those, so we're going to take those and get rid of those because they can cut and injure a patient. So we'll take those off. And a little tip I have from my MMA days, we're going to be using tape to secure this. I suggest cutting your tape before you start to wrap, because what happens is as you're wrapping, a lot of times you're trying to hold the bandage in place and you're trying to cut tape or rip tape at the same time, and it all comes unraveled. So pre-cut your tape. It's a nice little tip I'm giving you there. That's going to make it a little easier for you. So before I get started, I'm going to explain to Mr. Scanlon here the reason behind what we're doing. So I'm going to explain to him that he's just been injured. He has some acute swelling in his knee. He's aware of that already. So what the ACE bandage will do for him, it's going to help reduce swelling and aid in the healing process. So I'm just going to explain what we're going to be doing as far as wrapping from the bottom to the top. I'm going to have a little more pressure toward the bottom than toward the top. And that way he'll understand exactly what we're doing and he won't be confused by the process. All right. Well, we're going to demonstrate the knee wrapping. The first thing I want to do is I want to explain to Bill here, I want to explain to him the reasoning behind what we're doing. He knows he just injured his knee. That's why he's here. And he probably can see the swelling. So I'm going to explain to him the compression that the ACE bandage uses. It helps clear out some of the inflammation. It's hopefully going to help the healing process, and the inflammation being reduced will help it feel better as well. So the first thing I want to do is I want to go about mid-calf. And what I like to do, because once Bill starts moving around, what's going to happen is this ACE bandage is going to come right unraveled. If he is feeling a little bit better, he's going to want to get up and walk around. And if this is not secured at the bottom, so I like to use a little bit of tape just to hold it in place. I know when he takes it off, it's going to pull at his hair. But I'd rather that happen than this come unraveled, and then he tries to wrap it again, and they're not going to be able to wrap it the same way I do. So a first wrap is going to be a little bit more circular, and it's going to be tighter. So I want it more compression distally than I do proximally. So I'm going to come in here. Now I'm going to start some patterns, crisscross patterns. I don't want to do a circular pattern around and around because I'm going to do a tourniquet on them, and I don't want that to happen. I want the swelling to be able to drain from the affected area. So here we are. See that nice crisscross pattern? I want to go about halfway. So see how this overlaps halfway on this bandage previous. So I should have that nice little basket weaving look that goes with it. And you'll see that crisscross pattern right here. You'll see how it's halfway. And as I come up, I'm going to reduce the pressure. And I want to make sure I'm keeping that diagonal crisscrossing pattern. And as I mentioned, I want there to be less pressure toward the top than toward the bottom. And I want to start about mid-calf, and I want to finish about mid-thigh. Now at the very end, we're going to use some more tape. I'm not going to use those metal clips. That's because we want it to actually stay on and not come off. Now, the only thing that beyond this that I want to take a look at with Dan, I want to ask him, is it too tight? Does it feel like it's tingling? Does it feel like you're losing blood flow? How does it feel? Does it feel comfortable? Feels comfortable. Good. So I just want to make sure that it's not being compressed too much, and we're not getting the positive effects from the wrapping, which is to be able for the inflammation to be able to drain upwards and slight slowing of the blood flow into the affected area. So that's how we do our taping.